Good evening, afternoon, and morning, depend upon which part of the world you are living. Welcome to the Jaw Talk Show and Assalamu Alaikum from Amir Yusufi and Syed Jawad. You can watch our live show on Facebook page and YouTube channel SOT.JAH. Assalamualaikum Jawad sahab, कैसे हैं खैरियत से आज? Why you are looking 10 years younger than yesterday?
Wa alaikum assalam wa rahmatullah. I'm looking aged 3 years more than I am actually.
Oh, okay. Okay. Maybe my glasses number has been changed.
Thank you very much for a compliment. It is a compliment though, looking younger. But that's just the kindness that you have bestowed upon me. But on the other hand side, just to let you know that you are looking just the age you are. That is more than 70. I mean, I don't know
Yeah.
where you are exactly, but it's always above the 70.
I'm sure you will not have the good for me, so no worries. I have no any expectation. Okay, so
Uh,
Jawad, I think nowadays is very difficult position as we have discussed in some other show as well because of the COVID-19 and this pandemic situations. We have seen the peoples are more in anxiety. People have more in depressed and stress situation whenever they have, and it is very difficult to discuss with someone. And to me, if you have the good friend and if you have the some information about why we are coming to the stress, which we are talking about offline as well, uh, it is very crucial nowadays. What do you think?
well, I think it is, in fact, not nowadays, but it has always been that
Mm.
way.
Yeah.
The problem that anyone can have is a problem. But
Mm.
then what do we do is that we stigmatize that problem. We make it a point to be judgmental about.
Mm.
We make it a wholesome out of it. We don't empathize upon it. So there are many issues. You're right. Why we're talking about it is more important. It's COVID wave two. People have it, and if you remember, we did this show in the COVID one with Dr. Naima Hassan, where we spoke about it. That why we made such a hue and cry about Corona. We were associating ourselves from the patients. We were making their lives miserable. We were giving that judgmental looks to the
Mm.
patients. Oh, see,
Yeah.
he's Corona patient. Yeah, his family's went through the Corona. I'll narrate you a very brief incident. You remember, I was suspected with the Corona, and I
Yeah.
went for the test. So the from that point of at that point of time, they gave me the in-house sampling facility. So the hospital
Mhm.
sent their guys because of they were kind enough to send
Yeah.
the vehicle at my
They
home to
they
take
need
the
to
sample.
because they need oxygen from you. So
Well,
no
now
worries.
don't bias it, but
Okay.
they were kind enough. So they sent it, and they took the sample. Just that vehicle coming to my house and leaving my house, it
Mm.
made such a, I mean, news in the area
Yeah.
that I live in. And then
Mm.
everybody was coming and pointing out my house. Hey, see, this house has a corona patient in it.
My
So
God. Big issue. Yeah.
this is
Big issue.
so we make stigmas out of nowhere. We
Mm.
make things out of nowhere. We perpetuate it. We grow it. That is the problem. And then the situation causes the mental health, and mental health is own stigma. So who have
Yeah.
you invited today? That
Oh my God. That's why you are looking younger now. You already know
yes,
about that because we have invited on this topic a young and gentleman. Is very talented. A young guy. He's graduated from Queen's University. He has master's program in public health professional.
uh,
So he has also worked as a public health specialist for the COVID-19 pandemic reason with the Canadian National Institute of the Blind, which is called CNIB. We will ask him more about that. But it's a very relevant guest. One is a young from young generation. Number two, he has the experience how to deal with this COVID-19 situation. So let's welcome him, Ahsan Zaman. Assalamu alaikum, Ahsan. How are you?
Alaikum salam. Doing very well. How are you? How you both doing?
We are good. We are
Alhamdulillah,
good.
we are very
Yeah, to-
good. Glad to see you. Good to meet you.
Oh,
yeah.
thank you so much for having me. It's
Let
amazing
me
to
let me
be here.
let let me give you a compliment from the Iqbal's poetry. You know Dr. Ilama Iqbal.
I do,
Uh,
yes.
he, so he once said that जवानों को पीरों का उस्ताद कर. Peer means experienced people who has a lot of wisdom. So it's like the time has come when when youth needs to take the lead. I'm glad that you are taking the lead. Razi Naqvi, walaikum assalam, Khush Amdeed bhai. Uh, Razi Naqvi has been very consistent in our as our viewer, and I'm glad that he joined. It's very intellectual young man, very much into the information technology and all that. So,
That's great.
That's
Glad
great.
Essen,
to have him here too.
yes.
Glad you're watching,
Uh,
sir.
So, Essen, coming to you, thank you very much for your time. We understand that you're busy. Though you're young, but you are holding a very important position right now, and you are doing a very important thing for humanity. How is
Oh,
it
we
going?
have to all go apart, right?
Yeah. So, Ahsan, of the first thing which is coming in our mind, I'm talking about this from South Asia. I know you are living in Canada and you're
Mhm.
Canadian national. Uh, but if I'm talking about the South Asia, because our viewers and audience from that place as well, is still is the people, our parents wanted their children to be engineer, doctor, or MBA degree and some other. But this public health professional, why you choose this profession, and there is no any pressure from your parents and your family why you're choosing this profession, or in that area, in the western area, is not a problem to choose these topics, yeah, these professions.
That's a good question. So I'll just start off with from what I did. Uh, in my bachelor's undergraduate degree, I started at York University in Toronto and did a kinesiology and health sciences degree, which can lead to many different paths. It can be physiotherapy, medicine, dentistry, or any kind of health field. And I took that because it opened the doors up, and I'm glad I took it. And after going through my 4 years of undergraduate of my bachelor's, I was a part of this organization called Project Unload. It was a mental health organization that we started at York University, focusing on male mental health. And I'll give more details about that afterward. But when after you know going through that experience and learning about that, um, I wanted to keep doing more, and
Okay.
I wanted to affect more than just individuals. I wanted to affect a larger group of people, right?
Mhm, mhm,
So when I was doing my research on how I can continue my education, Masters of Public Health came up,
mhm,
and I thought this is an interesting field because it perfectly relates to health, and it can help people in the masses on the massive scale.
mhm,
Yeah,
And I thought, you know what, this is going to be something important to do,
mhm.
that's great.
and it's a growing field as well,
Okay.
especially now. I guess it was a quite a good time because I started last September, and I finished now, thankfully. But when I started last September, everything was normal, and then COVID-19 hit, and that was all public health based.
Yes.
Yeah,
So that blew
You
up.
see, Amir Hassan has a very good point.
mm,
He's clear-headed
very
young
clear.
man. He said that it has a lot of room to grow. Whether you are rich, you are poor, you are in west or east, health is the thing that is needed, and he's there
Great.
in the health. Essen,
Yeah.
let me come down directly to your project that you recently did, or you're doing currently. That is your pandemic handling, your policy
Mhm.
making.
Yeah.
You did something for the CNIB, I believe.
Yes, I did. So
That you
again,
made.
as you guys mentioned, it's called the
Yeah.
Canadian National Institute of the Blind. It's a
Okay.
non-profit organization in Canada
Okay.
focusing on how to help people who are partially or totally blind, who have lost their sight.
Okay. Okay.
And when I got into it, I got in as a public health specialist, which is a fantastic role, great opportunity.
Okay.
What I had to do there was I was one of the team leads for all of Canada, all the 10 provinces that have CNIB offices within them.
Mm.
And the role was to create a COVID-19 return to office initiative. That was the project,
Okay.
to bring people
Okay.
back to work after the lockdown, right? So my main roles were to create a policy, create new COVID-19 related policies so people can be safe when they come back to work.
Okay.
And and it's all based on occupational health and safety, because that is kind of the most important part, to keep your employees safe. And that was based on the company's portion, right? And
Why it
now,
was needed, Ahsan?
why was it needed?
Yes. Why whatever you did, why you made a policy, why it was needed?
Well, COVID-19 is something very new to us
Okay.
all. Something so contagious, something that can really cause health issues, especially to certain demographics like the older population. And of course, the rest too. Everyone can catch it. So in order to keep them safe, we had to change a few things around in the office. For example, social distancing, sanitation, hygiene. We had to make sure all those protocols are met based on what the government and I guess based on what the federal and provincial governments have mandated it to be. And that's what we based it on. And so we made the policies for it. But also we had to create a COVID-19 health and safety training course for all the employees. So they themselves have a good idea of what to do, how to act when they come into work. So it becomes both the responsibility of the organization and the employees themselves.
So Ahsan, would you
what
you're
what you
right.
have what you have seen, the changes when you have made that policy and training has been done? I understand the cultural difference is there, because I'm talking about, if South Asia, we have done the trainings, we have given the all policy and everything, but people did not follow. So what you have seen in your institute or organization is, after the policy, people has followed that policies easily, or you have some other consequence management or anything you have put over there in the policy to be implemented?
I was looking up on this because after I finished with my job, I wanted to make sure to see how things were going. So I kept in touch with my team, and it was actually a success. People were following the protocols and rules, and people were safe. So I was very happy to find that out.
Great. Ahsan, would you be frank enough to share some of the key policy points or action points, so that if people who cannot afford or do not have that facility, such as yourself, to make them a policy, they can do it by themselves? If you can just brief some of your key highlights about from the policy.
Sure. I can quickly go over that. Of course, I also made my policies based on research I had done. I didn't just think of it on my own.
Okay.
So
Okay.
it's good to always look at one, how to make sure the employee is safe, so and they're comfortable in their environment. So make sure that if sickness is around, allow them off days. See what you can do. Look at their home setting. For example, if someone is more likely to get a chance of being sick, for example, if you have another illness, or you have if your immunity is lower for some reason, then it's possible that you may not have to come back to work, because a lot of people feared that. Okay, what, I'm unwell. I have a higher chance of getting sick, and it'll affect me worse if I do get sick. Do I have to come back to work? No, that's okay. You don't. In certain circumstances, don't worry about it. But when you do have to come back to work, because hey, it is a job and the company needs you to come back for to the office, uh, make sure that all hygiene and sanitation areas are met. Have it always be clean. Have it provide uh, what is that called? Um, the alcohol. I'm forgetting the word right now.
Yeah, sanitizing, sanitizing. You need to sanitize. So it's a
Sanitizing all
more
that.
on
Yeah.
that SOP which we are following on that. So
Essentially,
that's great. So as a let's come to the our point. I'm pretty much sure our audience is waiting for this subject and they
Mhm.
want to understand more about mental health. So let's divide it in this topic in two categories. The one thing is people how they understand or they can identify him themselves or in the family if they have some issue in their mental health, how they identify what are the you can say the sign or symptoms. If we I have, so I know I have some issue in my mental health, so I need to go for the doctor and psychiatrist or whatever.
right. I can get to that right after this because I want because how it works
One thing
is
is
when you are going through something, it's never random. Mental health is never random. There's always a reason for you feeling a certain way, whether it's clear or not. There's always a reason. Now, for example, with COVID-19 right now, it's very prominent issue and very clear what's happening. When people were in lockdown, um, and I'm very glad that I was able to work at CNIB because I got to see this more clearly. Is it's good that people were coming back to work because when they were stuck at home, of course they had the fear of COVID-19. They were having economical issues, and because that they were in solitary, they were in isolation. So, economy and being in social isolation. These are the two things, especially right now, which have affected the mental health of everyone around you. Now, so now that brings me back to your question, which was, how do we know? It's a change in behavior, change in mood compared to a, if I can say, more normal behavior. So normally you're in a normal upbeat mood, or you're in a neutral state. You have your ups and downs, which is normal. But then when you feel that you're sad every single day, for example, for depression, and you feel, or someone else notices this, and these are the symptoms, so please do, keep in mind um, that you, or this whoever is feeling this way, very deceiving, no desire to do much in life anymore. These are signs of possibly depression. So if you someone if you see someone acting this way, make sure they're okay. If you feel you've changed into this, uh, talk to someone to tell them how you feel. Or if you don't want to talk to someone immediately, go to a doctor. A physician is probably the best person you can go to because they will help you, diagnose the problem. Because maybe you may have it, you may not. And if you do have it, don't worry about it. It's a normal thing. The thing is,
Essen, you said it is a normal thing.
mhm,
Well, I don't think so. That is how the society looks at it. I know you're trying to normalize it, but that's not how
mhm,
the society looks at it. Let's and that's what we actually want to talk about, and we want to hear from you. How do you think about it, and how you see it coming along? Uh, Man is considered as a macho, the savior, the conqueror, the fighter. And I say, we believe, or we are taught to believe, that men do not have weaknesses. It is not liked. Man is not like to have weaknesses.
mhm,
The weak moments are the low nerves. One has to have a very strong nerve. So he cannot lose his mind. He cannot lose his temper. He cannot lose his wisdom. How do you say, or how would you react that in our society, the society of mine and yours also,
Mhm.
see someone saying that I have a screw to fix in my head, how would people react to it?
So here's what stigma really is. It's a negative stereotype. And what you were saying just now about everything, you're perfectly right. And that's the unfortunate part. So it's a negative perception around people who have some sort of mental illness, right? And yes, to go further, to the males, as you mentioned, I can actually tell you why I got into male mental health, which is it was from York University while I was doing my undergrad, and Project Unload, now called just Unload. I was one of the first executive members of this group, and it started because one of my friends, who knew a friend of his, committed suicide. He was a male. He was our age, and this was about 4 years ago. So he was quite young. He was in his early 20s at most. And now the thing with stigma is that people living with mental disorders often say the stigma they encounter can be worse than the illness itself. And 60% of people with mental health problems or illness won't seek help for the fear of being isolated, especially males, as you mentioned yourself. So when we're looking at males, men are 3 to 4 times more likely to complete suicide compared to women, right?
That makes sense,
And
actually.
sorry?
That makes sense.
Yeah. It does. It does make sense, which is very unfortunate. And the thing is, people may think, oh no, men don't. Maybe women just feel worse, or they have more depression than men do, have more mental illnesses than men do. That's not the case. Because when there was a study done, I believe recently, it is in Canada, and I believe we can at least presume that in other countries it is at least similar, that 10% of men experience symptoms of mental health disorders compared to 11% of women. So there really is no huge difference at all. 10%, 11%. That's not a big difference at all. Yet they're 3 to 4 times higher in the rate of suicide, which is extremely problematic. And among all Canadians of all ages, I'm mentioning Canada right now because I'm living there right now. 4 out of every 5 suicides are male. Why? As you mentioned yourself, is the perception of males. They have to be tough, stoic, unemotional. If they show any kind of despair, they're deemed as weak.
Yeah, they said men don't cry. Oh.
Men don't cry, right?
Yeah.
If you cry, you're weak. We don't want to hang out with you. At least for my age, oh, he's weak. But why do I want to hang out with him? He's emotional. No thanks.
Yeah.
You can
And what
also
is
say
that?
Amir's age is same. Amir is of your age. No worries.
Oh,
Yeah,
we're all
yeah.
the same age, right? Yeah.
No, we are not same age. I'm of your father's batch. Amir is like your age.
Yeah. Thank you.
I don't know.
Thank you.
You both look close to my age. I
It's
won't
all
be able
about
to tell.
it's all about how you are feeling. So Jawad knows how I'm feeling. So it's dependent upon the age is only numbers. The feeling is actual.
Right.
You need to be happy.
Amir,
That's why we are trying to be happy in this show as well. Yeah. So
Right.
yeah.
As you said, it's all about feeling, right?
Yeah.
And when
Ahsan, I'm
you
sorry to
are
drag you somewhere else. Please,
no,
I'll
no
I'll
worries.
put you back on the question.
No.
So as
I have an
let's come back on your point from my question or any comments. So the stress which we are feeling nowadays, which you have already mentioned about some suicide in all of the countries, and I think in Western countries as more as compared to the South Asia and East Asia. So this stress because of the lot of pressure from society, is a competitions or any other reasons. How, if you are feeling, if someone is continuously in stress, how it can be in mental illness, you can say that, because of the stress only. Is it possible if you have the stress, you can be easily in mental illness?
For sure, stress definitely does lead to mental illness. I won't talk about it too much because I'm not a clinician, so I'm not as
Yep.
What's the word? And I'm not the
Fair
right
enough.
person to talk
Yep.
about this, but I can give a brief, output on it. Stress for sure it can lead to mental illness, because stress, anxiety can, be a factor for depression or any other mental disorder. Now the thing is that there are so many different reasons a person can have, for example, depression. Let's get a quick drink of water. Gotta stay hydrated, right?
Yeah.
So, there's so many different reasons a person can be, can experience mental illness, and it's not just stress either. Stress is a huge cause for sure, because one of the disorders is called the general anxiety disorder. That exists, so that, and people can experience huge amounts of stress, which can debilitate them and cause issues in their basic lives. Now, again, as I was saying, there are many different reasons people can experience mental illness, and that's because of it can be familial. You can experience from the family. It can be genetic. So if someone has had it before, slightly higher chance you can have it, or change in your life, a major change.
Ahsan, if you allow me, let's just say that someone got any sort of uh, imbalance or any sort of disorder, be it neurological or psychological. How would the society, if I am the one around someone who has some disorder, how should I behave? Number one, how can number one, how should I behave? Because right now we behave very, very inhumane. We stigmatize it, we becomes a judgmental, you know that. How should we do that? Number one. And we also not necessarily do it intentionally, we might do it unintentionally, because we have always been thrown this information to behave certain way, right? How to disengage with that behavior of ourselves? And number three question, I have put it you to three, a lot of questions at the moment, but the third question is, if I am the patient, how I should react, how I should approach someone.
Fantastic question. That's a really, really good question. So your question was, how do I react? The first question was how to react to someone who is mentally, unwell, right? The best thing you can do is don't isolate them. Don't put them on the side. Show support, be there for them, because that's what they need the most. If they need someone to talk to, please be there to listen, because that can make the world of a difference. Now, when you do listen to them, there are also a couple of things you should make sure of. When you do listen, stay quiet, take it all in, and give them the impression that you are listening. Reiterate what they're saying at the end of each sentence or so. Nod yes, and do listen. Ask them questions if you need to, or why are you feeling this way, but mostly listen. Don't talk too much, because allow them to talk about what they want to talk about, or rather what they need to get out, because that can, as I said, it can make the world of a difference. Now, again, when you do speak to them and they're kind of finished speaking, don't go and give them advice. That's not what they need right now. They just need a listening ear.
Yeah.
Right? That's the most. I think that's the biggest thing. And yeah, these are my top two tips. Listen, show support, and every now and then check up on them, see how they're doing. How are you? Are you doing okay? That and then if they ask you for some help, be there. And that's the most important thing. And they'll be extremely I'm sure they'll have a lot of gratitude for that. Now, one last thing I'll say for the person who is helping out: be careful for yourself too, because keeping yourself healthy is also extremely important. Because when you are in these type of conversations, it can be draining mentally. So allow yourself to calm down, relax as well. And if you need to take a break, do it, and let them know. And if someone asks you for help, let them know, yes, I'll be there. If you need some time to do something and then get back to them, let them know. So you keep yourself healthy and let them know that, yes, I'm there.
Yeah.
I'm
Yeah.
Okay. So,
right.
I
as you
think
say,
yes, Jawad, go ahead.
no, please go
There's
ahead.
actually also a question here, right?
Okay, I think this question is very important, which
I
we
think
have
so.
a little bit discussed, we touch upon, and Jawad has also asked the question similar, but it's a particular questions on the Pakistani, you can say the culture. As a wonderful discourse, as a Pakistani male, I want to know how you would remove the stigma which Pakistani men feel if they are told to take help for mental health. From Omar Lakhani. Yeah.
That's a good question too, for sure.
Yeah.
I know it's difficult there in Pakistan and South Asia.
Yeah.
The stigma, from what I know, is stronger there, as you both mentioned yourselves too. It's difficult to answer that because it's an issue that's there throughout the population. So we'd have to. It's awareness. It's awareness. So let your close. And could you put the question back up just so I can see it?
Sure.
How to remove the stigma which Pakistani men feel if they are told to take help for mental health. Well, if you are told to take help for mental health, take it. Take that advice, and you know what? Don't worry. As I know it's hard to say. I know it's very difficult to say. Don't worry. No doubt about it. Even over here in Canada, it's hard to say. Oh, don't worry. No one has anything. But take that as solid. You know what? Person, if you don't, you can. Okay, why am I? Why do you think I should take mental help? Right, mental
Do
health.
you think it's a taboo?
I'm sorry.
Going to a mental health. I mean, someone who can treat my mental disorder. Going to him is a taboo in the society, such as Pakistan.
It is, and that's because of the lack of awareness. That's the thing. So, what I believe that should be done is, honestly, you can start on an upstream level with the policies and bring it down to the individuals, the smaller populations, or you can go, you can go upstream and then downstream, or you can start with the population and go upward and make policies on how to deal with these things. But of course, these are big tasks. So I would like to just give the tip to the individual and say, just do more research. And because the more you know about it, the less you fear it, right? That's with everything. The less you feel taboo around it. When you understand that this is a natural occurrence, everyone can feel this way.
One more thing, Asin, that needs to be discussed is that once someone has a mental disorder, regardless whether he knows it or he doesn't know it, it will be one way or the other way reflected from his behavior.
Hmm.
The confidence becomes shaky. One will have low esteem and low self confidence and all that. So it will become suddenly a very poor personality.
Mm.
Hmm. For sure,
You
it
know,
can be
it
very
won't be likable.
personality.
Now, how do we, as a normal human beings, not experts in the mental health, not expert in any, said not much aware, how do we react
Yeah.
and how should we react? These are two different things. One state is how we are reacting right now, and how should we do it, and then what are the techniques to transform this, because I'm also human, I do not have a control on my mind all the time. So what techniques do I have to transform from what I'm behaving like, and what should I behave like?
And are you asking the question based on the person who is feeling this way?
No, the one who is reacting to someone with a low esteem, low confidence, mental disorder.
Oh, okay. So you see it happening, and then how do I react?
Yes.
Don't react. If anything, react positively. Be there for
So
them
I'm
again.
asking, how do we do that? I mean, see, we are judgmental people. We are a breed of judgmentals.
Mm.
Whenever we see,
We are.
let's say, if I have a slight, if Amir has a slightest idea that I have a mental disorder, I tell you on under oath that Amir will react. Suddenly, he'll make fun out of me.
No, what do you think? I did not react any time. I know everything, but I did not react. You can see how I am doing and how I'm dealing with you.
You see,
So there's no
you
any
see,
problem with that.
you see.
So
That was
Ahsan,
not a,
Ahsan is on the right path. He said, "Don't react." So I don't react. Yeah, thank you.
Exactly, exactly.
Okay.
Uh, talk to that person if you feel that there is a change in personality, as I mentioned before.
Mhm.
Talk to them, ask them what's
I think
going on in
I
their
think
life.
it's also depend upon. Is a good question what Joad is asked. I think this is a two ways. The one is the person who's already have some issue is mentally stress, anxiety, because of some reason. But when he is talking or he have some conversation with the other person, maybe he also have the same symptoms. So it will be a very difficult sometime to be react or not react. If someone understand, for example, what you are doing and what we are doing here, we are raising the awareness to people how they need to deal with that of people. If you have that in that issues or symptom, you need to go to the doctor and you need to have checkup and clinical your prescriptions and all the things you need to go. But the other person how they need to react is depend upon what is your condition at that moment. So this is also very important. What do you think?
For sure, very important.
Yeah.
Definitely, people go through different emotional states. Sometimes you see them a lot worse. Sometimes you see them better than they are.
Yeah.
Uh, of course, I'm not a psychologist. I'm not a clinician. I'm not a therapist. So, just the basic advice will give is just for now,
Yeah.
read up on it, raise your awareness, raise people's awareness who are around you.
Mm.
So when you do see these things, you when you have a better understanding, you know how to react,
Mm.
right? And the best way to react is, and of course, you don't just because you understand what's going on doesn't mean you understand how they feel. Also,
Yes.
so when you are talking to them, don't be like, "Oh yeah, I understand how you feel," unless you've
Mm.
been through it before. You can say
Mm.
maybe say that, but then it's best to avoid saying, "I understand exactly what you mean." You probably don't, right? You have your own hardships; they have their own.
Mm.
But did I answer your question, or do you want me to keep going?
Yes, Jawad.
No, I would love to ask a lot more questions, but the time is running.
It is. It
We
is. Yes, I've noticed.
just touched
I
our
can go
40
on
minutes.
too.
Yes. So thank you very much, Essen, for
No,
joining. And
no, thank you. One last tip I wanted to give
Yeah, sure,
sure,
sure.
is that when you are talking to someone, of course, you'd want to say, "Oh yes, don't worry, it'll all be fine. Be positive." Don't say that either, just because it doesn't help. It won't help. So just listen, talk to them, see how they're feeling, and be there. and raise awareness, learn, and this goes on for the South Asian community as well, and South Asian. Uh, Educate yourself. If it's not on a larger scale, bring it down to your level and start there. It's a tough thing to change, but I know it can happen. It's happening in the Western world. Um, it can happen in the South Asian world as well, for sure. I have
It's
faith
a
and
good.
optimism.
So it's mean the good listener is a good thing to when you are talking with that type of people. So it means you need to be listened carefully and you need to be helped. I think that's great
Thank you
awareness
very
what
much.
you have discussed already. So Jawad, I think this is also one of the things which we have already raised now, awareness raised now. Uh, as Asan already mentioned, a lot of people have gone through the suicide. Okay, and the life is very important, and this is actually we need to take seriously the people who have that symptoms. Please take seriously. Is could be happen anything with your life, with your family can be disturbed. Your all self as your health as also can be affected. So please take this all suggestions what Asan has given, and we will have, of course, some few programs more on this topic to understand more about that and more techniques to act on it. Yes, Jawad, I think we are going to close.
Yes, thank you very much, Essen, for joining us today. And all
Thank you
the
for having me.
viewers that have been consistently with us, thank you very much for joining. And those who have already left, I would request to come back. Please do subscribe our channel and like our Facebook page. We try to create a content which is helpful and support the society. Uh, Here I like to talk to the people in Pakistan and India and Bangladesh, all these Indian countries, uh, South Asian countries. We don't have that strong support system as a society for people with this mental health issues. It is taboo and we have stigmatized it to the much. What we need to do is we need to create awareness. What we need to do is we need to create a support system as a society. I know for a fact that in the West, they have these support groups where they meet together, they talk about it, they do a lot of stuff. Essen has taken a very good initiative in creating this awareness session. Essen, thank you very much again for the noble cause that you associated yourself beyond only your job and the financial aspects. You have taken up a challenge to support the society. Hats off to you, young man.
Thank
You
you.
We
are
have
inspiration for young people. Yeah, yeah.
learned a lot from you, and I'm sure you'll be an inspiration to many people out there. Amir and me, we are always there to create to bridge that support for people. I'm sure when Amir will be in Pakistan next time, we'll create a support group in Pakistan
Sure.
for people with a mental health. Since the start of our show, we have been talking about the behavior and the mental health and the psychology. SN is our fourth professional on our show. We had Naima Hassan and Hassan and SN. All these people have contributed voluntarily, and we are thankful to them. Similarly, every individual who is watching us or who would watch later from the YouTube or Facebook or any other platform are requested to create awareness.
Yeah.
You can create awareness, and that's what you can do. That is the best you can do. We are not doctors, we are ain't health professionals as SMEs, but what we are human beings, and as a human beings we have to have that responsibility. Does not make any stigma out of it. Let's make it normal illness that someone can have. Thank you
Yeah.
very much. Please do take care of yourself. It's COVID. Follow the SOPs. May Allah bless you from Amir, Hassan, and myself. Allah Hafiz.